Howdy ho everybody, this is Nancy D again. It is still Halloween, the 31st of October, and I have one last video. This one is going to be a quick one though. This is just a quick and dirty of the to-dos. I had my dressing change this afternoon and we just sort of reviewed the to-dos. The nurse was really good. I can't say enough about the amazing care I've gotten throughout, from pre-op through the operation at the surgery center and then post-op at the surgical, at the treatment center here where they do my dressing changes. Everybody's just been marvelous, but the one thing I will say is that at the treatment center, it seems like every day that I've gone, I've had a different nurse doing the dressing, so be aware of what your incision looks like. You have to be the one who is your own advocate, and you need to judge that yourself. So what I'm going to do in this video is I'm just going to give you a quick to-do list of the things that we talked about today while I was at the treatment center, the things that will help to facilitate a good post-op, hopefully recovery phase for you. Again, I am not your healthcare professional. I am a fellow patient sharing information with you. If your physician or care provider explicitly tells you not to do something I am saying is a good idea here, please follow their advice, not mine. So one of the most important things is rest. You need to get a lot of rest. You need to get your full 8 to 10 hours of sleep a night. And you need to nap throughout the day whenever you're tired. And to begin with, that's going to be a lot. And I'm 2 weeks out and I still get really tired. So I nap every day and I try to sleep as best I can during the night. Some nights it's broken, but I sleep whenever I feel like sleeping and I don't feel guilty about that. Second thing is your protein intake. Very, very important. You need protein to heal, to build the new tissue, to knit together that incision, and so you need to ensure that your protein intake is sufficient. So lots of protein, folks, which we all know about as weight loss surgery patients. That's our priority. So and along with that, of course, all of your vitamin supplements, please ensure that you are taking those as well. There's been some research out there that shows that zinc, magnesium, and vitamin C, I think, are the three over and above your normal ones that help to increase healing. But again, please follow your care provider's instructions. If those are contraindicated for any reason, then you should not be taking them. Fluids, lots and lots of fluids. Again, this is not new to us as weight loss surgery patients, but again, it's very important during this post-op period that you do not become dehydrated and that you drink enough fluid. So lots and lots of water, juices, whatever. And exercise. Obviously, we can't do the vigorous exercise that we're hopefully doing on a daily basis as part of our normal regime for a healthy lifestyle. But it is really important that you get up and you walk. Walking will help to increase your circulation. I talked about that in one of my other videos today. Also helps to prevent blood clots. So whenever you're awake, just get up and walk for a few minutes. That's so important and so helps the healing process. Wear your binder. It's really important that you wear your binder, and once you're out of the binder, the compression garment of choice of your care provider, it's what's going to help your, it supports your incision and your abdominals while your abdominals can't because they've been weakened by the surgery. So it's really important that you wear those. I did mention in my one video that I'm not wearing my binder because it was causing irritation to my incision. So that was on instruction of my physician. But I am wearing compression panties, and I actually have 2 pairs on because the ones that I bought that he wanted me to buy have snaps or hooks all the way down the side and zippers, and I can't twist yet enough to do them all up. And the compression garments, panties that I had didn't have enough compression. And so what I'm doing is I'm wearing 2 pairs of them right now in order to get that tighter support. And just as soon as I am able, I will be wearing the ones that he suggested. I don't have them here, so I will show them to you in another video because I will be doing a few more videos coming up. Keep your incision clean, dry, and protected, okay? So as I mentioned, I'm not showering yet just because of the irritation that I have in the central part of my incision from the binder. So until that settles down, I'm just doing the sponge baths and washing my hair in the sink. And I know I'm looking beautiful right now because I just woke up from a nap, but that's okay. But it's really, really important that you don't soak that incision, even after it appears to be healed and the scars and there's no scabbing on it. that skin is still very vulnerable. It's still very tender, and you don't want to be soaking it and keeping it wet because that could be detrimental to your skin integrity. So just take care of it, baby it for a while, and keep warm. That's something here in Saskatchewan. It's getting colder. It's around 0. We've had little bits of snow. Didn't stick around yet, but she said you want to keep warm, and that makes sense because if you get cold, your blood vessels constrict, and that's interfering with blood flow, which will interfere with healing. So keep yourself warm. The other thing that I want to talk about is your bowel care, because the other thing that we want to make sure we're not doing is straining when we go to the bathroom, because of course that impacts our abdominal wall again. So for me, what was written was that I should be taking Colace or Senecot S daily. Again, follow the instructions of your care provider. The Colace seems to be working fine for me. I take it every other day, or if I haven't gone, then I will take it a couple of days in a row, and I seem to go with no issues. So that's been working well for me. I think those are the main things. Just be kind to yourself, love yourself, and you know, you've come this far. Don't be doing anything stupid to ruin it. I'm not supposed to be lifting anything. I think it's heavier than 10 to 12 or 15 pounds, something like that. So I'm not. I'm not supposed to be vacuuming. My mom vacuumed before she left. I live alone, so you know what? If I'm not doing it, nobody's doing it. And you know what? If it doesn't get vacuumed every week or twice a week, that's okay for the next little while. Now, granted, I am here alone, so if I don't mess up, it's not going to get messed up, but you need to let go some of that OCD. Everything's got to be perfect, because it doesn't. You need to look after yourself right now. A couple of warning signs, just red flags that if you have this happening to you, you need to report it to your physician ASAP. Don't wait 2 days or 3 days. If it starts happening, if it's a change, you need to report it as soon as it becomes a change. If you notice, for those of you who are doing your own dressings at home, if you notice that your incision is becoming more red, so sometimes it might be just a localized irritation. If it's not that concerning, what you can do is actually mark how far up from the incisional line that redness goes with a permanent marker, and then just watch it. If it goes beyond that mark, by the next dressing change, then you should definitely be reporting it to your physician. If it drops back, then maybe it was just, you know, you banged it or something, but keep an eye on it. If you have increased drainage suddenly for no reason at all, and especially if that drainage is foul smelling, you need to report that to your physician ASAP. If you have chills or a fever, you need to report that to your physician ASAP. And the other thing is, everybody's going to have different levels of pain, and I have a very high pain tolerance, so I haven't had a lot of pain from day 2 post-op, really. Like I said, I have only been using the Tylenol Extra Strength. But as you progress, whether you're somebody who has a lot of pain or doesn't have much pain, as you progress, that pain should be decreasing. And in the very least, it should not be increasing. And I'm not talking about, you know, muscle spasms in your back, etc., from lying and stuff like that. I'm talking about actual incisional pain, pain in the area that you had surgery. If that suddenly starts increasing, or you start getting sharp pains where you didn't before, if there's a change that's worse, please be sure to report that to your care provider ASAP. Anyways, I guess this was longer than I thought, but this is just sort of a quick and dirty of what I was told are the to-dos and some of the red flags that you need to report ASAP. I hope that you're all doing well. I hope that you're taking care of each other. I hope that you're loving on yourself and loving on one another. Make a great day.